Carolina's healthcare system has a weight loss and bariatric program which consists of teams of surgeons as well as teams of non-surgeons to help people who are struggling with weight issues. I think one of the things that sets us aside is the fact that we have all of these specialties under one roof, and that also includes dietitians, exercise physiologists, and mental health providers to help people with their weight needs. Patients who are candidates for weight loss surgery have body mass indices greater than 35, and that's roughly about 100 pounds above ideal body weight. Everybody's different in terms of the amount of weight that they can expect to lose with weight loss surgery. It's difficult for any clinician to give an actual estimate of how much weight someone will or won't lose. However, we know that with two of the procedures, specifically Roux-en-Y gastric bypass and sleeve gastrectomies, by 1 year the majority of the patients can lose somewhere around 60 to 70% of their excess body weight. There are several options for weight loss surgery. The most common is a Roux-en-Y gastric bypass procedure. That's been around since the 1960s, and now it is performed laparoscopically since the 1980s. A second weight loss option is a relative newcomer, and that's called the sleeve gastrectomy. That's been around for approximately 5 years. And what that procedure does is it removes 60 or 70% of the stomach. Also an extremely successful procedure, again with excess body weight loss somewhere around 60%. And then the final procedure, which is losing popularity in some regard, is laparoscopic adjustable gastric banding. We still offer all three procedures, but the majority of what we do are either gastric bypasses or sleeve gastrectomies. The risks and complications associated with surgery, fortunately, are rare. The ones that are most concerning are leaks from staple lines and bleeding. Certainly in our center, those risks are well below the national average and way less than 1%. A majority of patients can experience some early nausea, but that tends to improve over the first week or two. All patients should discuss with their clinicians which particular surgical procedure is right for them. I think it's important that whatever procedure a patient chooses, that he or she is comfortable ultimately with the decision that they make. The goal of weight loss surgery, in addition to losing weight, is to improve upon patients' health. We often see patients who have many comorbidities in addition to being overweight, such as diabetes, sleep apnea, high blood pressure, and the goal of these operations really is to improve or to eradicate these other diseases. Recovery after surgery really depends upon the procedure that's being performed. I would say that in general, most patients are home by 2 days after surgery. So they spend 2 nights in the hospital, and the majority of patients are back to work by 2 weeks after surgery. We would ask that nobody perform any heavy lifting over 10 pounds for 6 weeks after a surgical procedure. The diet after surgery in general involves liquid diet for the first week, a blended diet during the second week, a soft diet during the third week, and then by a month after surgery, most patients are back to eating their preoperative diets just in smaller quantities. Anyone who's interested in weight loss surgery will need to attend a free seminar, and the way that you enter into the free seminar is through our website.